Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on pathophysiology of vasovagal syncope. We will explain the mechanisms behind this common cause of fainting. Understanding these processes is crucial for effective management and prevention. This flowchart is the step-by-step process leading to syncope. A vasovagal syncope often starts with a triggering event such as anxiety, pain, or fear. These emotional and physical stressors initiate the body's response, leading to the sequence of events we will discuss. In response to a trigger, the sympathetic nervous system is activated. This leads to the release of catecholamines like epinephrine and norepinephrine. As a result, heart rate increases and blood vessels constrict to elevate blood pressure temporarily. With sustained stress, the parasympathetic nervous system kicks in. The vagus nerve is activated, causing vasodilation and bradycardia. This shift counteracts the initial sympathetic response. Vasodilation causes blood vessels to widen, particularly in the lower body. This leads to blood pooling in these areas, reducing peripheral vascular resistance and contributing to a drop in blood pressure. The combination of widened blood vessels and a slower heart rate results in a notable decrease in arterial blood pressure. This sets the stage for the body's compensatory responses. The body attempts to compensate for drop in blood pressure through the baroreceptor reflex. This reflex increases sympathetic activity, raising the heart rate and triggering other autonomic responses like sweating and rapid breathing. If the compensatory mechanisms are insufficient, decompensation occurs. The parasympathetic effects dominate, leading to a prolonged bradycardia and low blood pressure. This failure to stabilize the blood pressure and heart rate results in inadequate blood flow to vital organs. Reduced cerebral blood flow follows decompensation. The brain receives less blood, leading to symptoms like lightheadedness and dizziness. If not corrected, this can progress to syncope. Syncope occurs if the brain blood flow remains insufficient, causing temporary loss of consciousness. In rare and extreme cases, prolonged lack of blood flow to the brain can result in seizure activity. This flow chart summarizes the pathophysiology of vasovagal syncope. It highlights the alternating roles of sympathetic and parasympathetic activities. Use this chart as a reference to understand the step-by-step process leading to syncope. Understanding these mechanisms helps in managing and preventing vasovagal syncope effectively. Thank you. Wish you best of luck.